Hi everyone, I'm Dr. Naresh, CEO of Medicine. I have around 12 years of experience in medical coding. I worked as a coder and I practiced also. I worked as a coder and as an auditor and also worked as a subject matter expert and also a director for the company. Today is the topic in this podcast is all about the medical coding. It's not just what is medical coding, how to take the medical coding training and what are the opportunities in medical coding, and to discuss clearly and crystally from our guest and my guru, Dr. Santosh Kumar Gupta, founder and CEO of Medicine. Today is here. Hi sir.
Hi Dr. Naresh. Thank you for this interview. Yeah.
I just want to know that how the Medicine Academy is different from the other academies. What are the methods you follow?
Thank you, Dr. Naresh. So, first of all, everyone should understand that medical coding is a highly skilled job. It's a noble profession. You have to work with heart and soul. Only certification, going through the books and just going through some few guidelines, passing the exam is not all useful. It's a highly skilled job means what? You should have a practical training. So, what we do at Medicine, we provide training theoretical part. The first 2 months using the coding manuals because exam is an open book exam. Then 1 month we give training extensive on the practical knowledge. So every medical coding student, we train them on more than 3,000 questionnaires, 3,000 question bank and more than 500 medical records. A practical approach. So what happens here, once when they go for interview, they get clear the interview properly and the company can save the time for retraining. So we give training for 4 months, not 1 month or 2 months. So 2 months theory training, 1 month practical training, and 1 month we give live simulation experience. So this way, medical coding is totally unique. And you can see our students of medicine, they got very good jobs nowadays and they are all certified also. So that's why, and also at Medicine, we are the only institute in India offering the course called CAIMC, means Certified AI Medical Coder. So as you know very well, future is AI. If you are a medical coder without AI skills, medical coding certificate is of no use. Every coder must have the AI knowledge. So to cater that need, we are providing training for the CIMC along with the credential also. That is called Certified AI Medical Coder. You can browse internet everywhere. Medicine is the only academy offering the CIMC.
So just tell me, sir, how along with the other certification, CIMC is useful for the coders.
Okay. Fine. So, for example, you have done some medical certification. Yeah. You went for the job. Now, what happens here? Now, the company may give you 50 records, 100 records per day for you to code because quality important, quantity also important. Now there are so many ways you can do the coding with accuracy and following HIPAA compliance. So what's happening? Many medical coders to improve the efficiency and efficacy, what they're using the ChatGPT. And ChatGPT is not HIPAA compliant. You cannot copy the medical record on ChatGPT and you cannot take the codes because as per HIPAA compliance, you have to maintain the privacy and security. So every medical coder should know how to use the AI properly as per the HIPAA compliance. And also you should know basically about the NLP, about the NER, and what is RAG, and what is sentimental analysis. So many times there is we say AI has hallucinations. It gives a wrong code. So simply using the AI like google.com is of no use. So professional training is compulsory required. Already we have seen there are so many layoffs, medical coders because companies using the AI for the accuracy. Suppose if you know about the AI, if you are certified AI medical coder, automatically you are not replaceable. So in the future, people who don't know medical coding with AI, they are going to be replaced. And people who knows the coding with the AI, they are irreplaceable. You can survive in this market, you can get the very good salaries.
So you're saying AI is must for the medical coders. Compliance with the AI tools.
Yes, compliance is important. Also, you should know how to use it properly because it's like a knife. So you cannot use the way you want.
So they should have a basic knowledge about the
basic and advanced knowledge also.
Okay.
That's why what we do, we combine both. So we give traditional training in the medical coding, practical training, live simulation plus AI also for every student.
Just let me know, sir, after doing this one credential in coding and also along with the CAMC, so which institutes and which organizations demanding these coders?
Okay, so especially HCC coding, now in future after 3 or 4 years, 80% work is going to be done by the AI only, especially HCC coding, pathology coding, radiology coding, outpatient coding. Automatically AI can assign the codes and we require only medical coders to analyze the work. Okay, let me give an example. If you take the pathology coding or radiology coding, we have seen so many AI tools, they give accuracy of 95%. Instead of requiring 100 medical coders, I require only 10 coders only. So you are going to become an AI coding analyst. That's why I'm telling every medical coder should learn the AI compulsory. It's totally foolish to learn only one certification and going for the job. Okay, and again, don't worry. AI is not going to take your job. AI is not going to replace your medical coders. AI is going to help you to make your work efficiently. If you know about the AI, you can provide the accuracy, quality, and quantity. If you don't know the AI, and you may give less, the less quantity in the work, automatically quality will decrease. So use the AI as per HIPAA compliance, improve efficiency and efficacy.
So most of the jobs is going to be auditing and validations in this.
Yes, and so in the future you'll be finding only AI medical coders, AI medical analysts, AI medical auditors, not the medical coders. Yep.
Can you please let me know, sir, about the CPMA?
Okay, CPMA means Certified Professional Medical Auditor. This is from AAPC. Excellent credential, huge demand in the market, especially in UAE and USA. CPMA itself says you are auditor. So once you take training for CPC, after 2 or 3 years of the job, again get certified in the CPMA. I'll give an example. In 2012, when changing from ICD-9 to ICD-10, 12 to 15, the 3 years, there was demand for the CPMA, for the auditors. I'm the first person in India who taken the CPMA cleared exam in Hyderabad. Then I trained a lot of people. So if you ask me why you done CPMA, because if I'm not certified in CPMA, how can I train the people, right? So first of all, to train the coders, first of all, I should get the knowledge, I should get the skill. I have to clear the exam, then I can help the people to clear the exam, right? Then I've done the CPMA, and the CPMA is a very good credential, and once you do CPMA, you can become a manager or you can become an auditor. Because in CPMA curriculum, we teach in detail how to audit the medical record, how to assign the medical codes properly, how to audit the medical coding, how to follow the NCCI guidelines. So these things are very important for the coding, especially because medical coding is it's a skill job and you have to follow the compliance. Any medical coders, if you experience more than 2 to 3 years, take CPMA to become manager or auditors. Don't miss the opportunity. At medicine, we give training for CPMA. I am certified CPMA, and definitely I'll help you to clear the exam with the 2 months training. However, you should do rigorous homework and work on more than 500 medical records auditing. Then only you can clear the CPMA exam. There are no shortcuts.
So can you please tell me, sir, CGSC, what is CGSC?
Okay, very good question. CGSC means Certified General Surgery Coder. This is also from APC. CGSC demand is very, very high. If you're a medical coder and you're a doctor plus CPC or B Pharma plus CPC or nursing plus CPC, then you're good for the CGSC because surgery coding requires very good clinical concept knowledge. I'm also a medical doctor. All trainers in medicine are doctors. So we know exactly how the system works. We have the clinical knowledge. Not that we read some books and give training. The trainers of medicine, Dr. Santosh Gupta, Dr. Naresh, Dr. Siddharth, all Dr. Pavani, all these people are doctors by profession. We have seen the clinical scenarios live. Then we taken the coding training and we give training to the people. So coming to CGSC, surgery coding requires very good knowledge in the medical terminology and anatomy and physiology. And you can see surgery coders salary is more than 80,000 salary per month, and some people they get 1 lakh salary per month. And surgery coding you can do work from home also. So to get that wonderful job, you have to clear the exam called CGSC. So we give training for 2 months. With 600 medical records, live medical coding practice, and we teach you the medical coding guidelines, especially CPT guidelines, how to assign the modifiers, how to assign the NCCI, MUE in detail, and you can clear the CGSC exam and set a surgery coder. And once you get a job as surgery coder, trust me, you are settled in the field. You get very good salary, 1 lakh per month, comfortable salary you'll get, especially because nowadays in USA, they prefer only the SDS, same day surgery, not the inpatient. So, because of aging population, demand is more for CGSC. Now, I can say throughout the India, we're only giving training for CGSC because nobody is certified. Unless you're certified, how can they give training? So, I cleared CGSC exam. I trained more than 500 students and they get certified. And please come to medicine. Definitely we'll train you and we help you to clear the CGSC exam and also to get a very good job.
Sir, please now let me know about the CEMC.
Okay, CEMC means Certified EM Coder. Now you can see as per the OAG reports, there are more denials in the EM coding only. Especially what happens for the nowadays, EM code there is a confusion. MDM always a challenge.
Yes.
Even though you can assign the codes based on time, MDM is completely it is completely contextual based. And denials are there. Even if you see some insurance companies like Aetna, they said they are going to downcode 1 level. So doctors panic because when they downcode 1 level, automatically they lose the revenue. So demand is more for the EM coders. Again, to become a EM coder, CEMC, you should be a medical student or should be a student from the pharma side because it's highly contextual based. I am a CEMC certified person. I cleared CEMC exam in the year 2014. We trained more than 1,000 people in CEMC and they're working as a EM coders. And if you see in all specialties, EM coder salary is very, very high. And even if you see vacancy also, you can see vacancies only for the two jobs, especially surgery coders and EM coders. Why? Because they're highly skilled job. So if you have a passion to learn, to make more money, work from home, can spend 2 months for learning, I suggest to take the CEMC training and get certified as an EM coder. And I'm sure you get work from home also. There's a demand for the CEMC.
Coders thinks that in everything is like some matching. Some projects, require the more skills.
Yes, so it's not that, see, there are so many softwares are there in the online, right? What they do, they click, tick, tick, like that. New patient, established patient, right? Waste of time. No, anybody can do, right? It's not like that. You lose the revenue if you don't do properly, and when upcoding, downcoding is very dangerous, right? For that reason only, CEMC demand is very, very high.
So, and I heard about, sir, about the CDIP also, Document Improvement Certification.
Yeah. So, CDIP is from Mahima. CDIP is Supreme Certification. I can say so CDIP is a PhD certification. So, generally what they do, first they do CPC, then they do CCS, then they go for CDIP. CDIP is a Supreme credential as per my opinion. It has very good demand in the market, especially in the UAE. Even in India also, demand is more for the Indian healthcare also. CDIP, what they do, they are the integrity practitioners. They help the providers how to document the medical record, how to document as per the compliance. They teach the coders how to code properly. They are bridge between the coders and the coders, insurance companies and the providers. So that's why CDIP demand is more. And to pass CDIP exam, you require minimum 3 months of training. Because you should know about the OP coding, IP coding, DRG, HIPAA compliance, medical billing, AI, ethics, and also about the documents improvement. So definitely take 3 to 4 months of training. And the CDIP training we provide from medicine. And as of now in CDIP, we have accuracy of 95% pass rate. So if you're from UAE, if you're from USA, if you're planning to go to abroad, I suggest to go for the CDIP training. And once you pass CDIP, then you have very good future.
Yes, sir. And also I heard about the CHA, sir. CHA certification.
Okay. CHA means Certified HIPAA Administrator.
No.
See here, every company has to follow the HIPAA compliance. Not only every company, any entity, even the person, coders, builders, everyone has to follow the HIPAA compliance. It's like a Bible for us. We take the oath that yes, we maintain the privacy and security. So when you have 20 employees in a company, you require one HIPAA officer, a privacy officer, because you have to ensure the privacy and security of medical records. So what we do here, we give training on HIPAA compliance in detail. We help you to create the exam called CHA, Certified HIPAA Administrator. So as a CHA, you are a privacy officer in a company. You ensure the HIPAA compliance, privacy and security of the medical records. So when the client in the US also, they feel very happy that yes, we have somebody who has knowledge in this HIPAA compliance. They are certified HIPAA administrators. And as CHA, you have the more accountability and you can ensure the HIPAA compliance. So if you are a company manager, a TL, or a QA, or a CEO of the company, I suggest to go for CHA training and the exam. And this is valid for 3 years. We give training for CHA also. I cleared CHA in the year 2008. Trained more than thousands of people in the HIPAA compliance. And I'm very happy. Now you can see plenty of work is coming to India, especially to Hyderabad and Tamil Nadu and Pune. Why? Because our companies, they follow the HIPAA compliance. The people in India, the coders, builders, they go by the oath and ethics. They follow HIPAA compliance. As a trainer, as a responsible citizen and a trainer, first I teach HIPAA compliance to all my students, and then we go for the coding training, because compliance, ethics are very, very important in this profession.
How medicine is giving a different way, what is the method, along with CPC?
So, okay, fine. So, to start a career in medical coding, first of all, I suggest to go for the CPC exam. CPC is the best certification, recognized worldwide, and the CPC means if you can feel proud that you are certified coder. But along with CPC, I suggest to take training for the medical billing also, and also place the AI. So, see, nowadays in the market, only coding is not useful. Coders should know about the billing, builders should know about the coding also. And also on top of it, you should know about the AI. So to cater this need, medicine is providing training for the CPC exam. Plus we provide a free CPMB. CPMB means Certified Professional Medical Biller. Plus CIMC, AI Medical Coding. So at medicine, what happens when you go for the 4 months of training, you clear CPC exam, you clear CPMB exam, and you become an AI coder also. You clear CIMC exam. You're going with 3 credentials. Now go to any interview and tell that you're a coder, a builder, and AI. Automatically you can get the job, because you go through 4 months of training. You study coding, you study billing, study the AI. Your IQ level will increase. Your confidence will increase. That's going to help you to get it. That's why you can see the students of medicine, they get job comfortably. Why? Because the way how we train the people. And again, it's not just through books, We give practical training, live simulation, so that companies can save the time also. That's why you see why companies they want students of medicine, because see, I'm in this field since almost 21 years. I cleared my exam in the 2004. I think 2004, I think you may be just born, I think, right? In 2004, I cleared the CPC exam. I went to US in 2004 and taken training for 6 months. I got CPC. So 21 years back. Since 2004 to 2025, 21 years I'm saying, this coding field is growing every day by day. Why? Because we have the skilled people in India and the better how we train. So I can say that if you want to come to this career, be prepared to have the patience and get the skill. Only certification is of no use.
I agree, sir. Because when I work for a company as a director, I did so many interviews also. That is true, sir. You are maintaining the quality. And people, whenever we are recruiting now, people who got the training from the medicine, they are well, performing well.
Yes.
And somehow, compared to the others now, they will answer some and they have a different type of knowledge.
Yeah. See, I tell why companies they choose medicine because, see, when I started training in 2005, 2004, a lot of trainers even, they're not even born, I think, right? They're young people, trained trainers are there. I'm training since 21 years. My students are now CEO of the company. Now they have their own companies and they are the vice president of the company. They are directors of the company. They know the value of the medicine. They know how we train because they are products of medicine, right? Because we train them properly. That's why they choose students of medicine. Second point is, we get the feedback from the companies. The companies tell Gupta, I want training like this. They said this is the way how we want training. Now, recently, when a company called, they said they want 50 surgery coders. So what we done here? They give training for CGSA. CGSA means Certified General Surgery Coder. They cleared the exam and they got the job also. So these are how we cater the industry need.
Sir, one thing I can say, I observed also from the past 3 years, sir. There are so many academies and falling in wrong methods they are using. 1 month, 15 days training for the medical coding. I don't understand what they are going to do. It's like MBBS is completed in 1 year. No one is going to do that, doctor.
Exactly.
If the training is completed in 1 month or 15 days, now how they can perform the job?
See, to become a medical coder, skilled medical coder, minimum 200 hours of training is required. Official training, I say 80 hours training is required. Classroom training, 120 hours practice is required. So 1 month training means even if you spend 2 hours per day, it becomes how much? Only maximum 60 hours. How it is possible? You have to work for 200 hours. And see here, there are no shortcuts for the skill. There will be shortcuts for the other things, but not for the skill. I see the people taking training for 15 days, 1 month training. You may clear the exam because the exam is a multiple choice exam. Simply if you type A, B, C, A, B, you may pass the exam. But what is the use? When you go to the company, you will get the job only when you clear the company exam. So if you pass some certification exam, if you don't pass the company exam, how will you get the job, right? So we train them to clear the company exam. That's why we give training for 4 months, not 1 or 2 months. Even somebody said they train 1 month, we say no. Because you have to go in a systematic way. Basics to advanced, coding to billing, billing to AI to HIPAA compliance. We cover 360 degrees in the domain and then we tell them we are ready for the jobs. That's how we train. So again, keep in the mind, there are no shortcuts for the skill, no shortcuts for the exam. And if you fell into this trap of 1 month training, 15 days training, crash courses, don't go for all those things. If you already trained somewhere, then you can go for the crash course. But as a fresher, don't go for the crash courses. Your career is going to crash. See, I'm in this field 21 years. I trained 25,000 people. So I know very well. I cleared 45 exams. I cleared UK coding exam. I cleared Australia coding exam. I see the depth of the medical coding. So follow my advice. So go for a professional training. Minimum 2 hours of practice.
Maybe, sir, most of the freshers don't know about these facts. They may go for the certification. Just having the certification is enough.
Even if you see now, based on statistics also, 100 coders going for interview, 10 coders only getting the job. Why? Because it's not certification, not because they only have the skill. Just this is a skill-based program, skill-based domain actually.
Yes, sir.
That's what I'm suggesting to all medical coders. So don't think that you come to a training center, you pass the exam, you get a wonderful job. No. 60% people, they're not getting jobs because they lack in the medical coding skill. So beware of that this thing, right? And please note that skill is must, practice is must.
Sir, you said that there are different methods you are using. Along with the training, you said simulator, coders grade, internship.
Yes. So we provide a tool called Coders Grade. Coders Grade is a tool developed in medicine with my experience expertise. Coders Grade contains more than 1,000 medical records from all specialties. So first we give 2 months of training for any medical coders. Then 1 month we give the practice sessions, live simulation. So we give a tool called Coders Grade tool. In this tool, students can log in. They can answer the question. There's no multiple choice questions in the tool because live work is not multiple choice, right? So you read the medical record, assign the codes as per the guidelines. We teach how to use the medical coding tools also. Like this is 1 month they clear, they go to 1,000 medical records. Then they get the confidence, they get the knowledge, they get the practical knowledge, they get the skill. And then they go for the exam. So Coders Guide is an excellent tool for them to practice the medical coding, the live work simulation. And the companies also appreciating us. Why? Because when they get training from the medicine, they can go to production immediately. They can save a lot of money and time.
As you said, sir, practicing, it's like in a simulator. It's not a real project, but they can get the experience in a real-time experience by practicing on the challenging documents. Yes. Even though every employer also, whenever they took members now, they will look for the people with skills.
Exactly.
So it's going to save a lot of the time.
Yes.
But is it necessary for the fresher, sir? Just having
It's
the certification?
compulsory. See, without proper knowledge and skill, if you go for interview, you may pass the interview, but you can't do the job. Half cooked, right? It's not useful.
Yeah.
That's why we have a tool called Coders Guide tool. It contains 1,000 medical records, all specialties, anesthesia 50 records, dermatology 50 records, cardiology 50 records, respiratory system 50 records, pathology 50 records. So what happens is, these records are the actual live work. We say DIA, means de-identified records. There is no patient identifiers. And we teach them on the records. And they use the medical coding books or the tools. They send the medical codes. They follow the guidelines. Again, trainers, they check how they done the coding as a QA. We teach them how to do the coding properly. That's the way how they learn. So imagine when you work through 1,000 medical records, a live work simulation part, see the content what you're going to get. When you go for interview, it's become cakewalk for you. So see, one more thing. In the exam, you may get a question of 3 to 4 lines with multiple choice. Live work, no. You have to go through the medical records, right? So that's the reason why we give the live work simulation experience to Coders Guide. They can come to the medicine office and they can practice in the office, or we give logins to them, they can work from the home also.
So I understood that, sir. Just having the certification and not producing the people with the skills.
Yes.
At least if they have some experience on the real-time documents, now they are ready to do the job.
So at medicine, keep in mind, we provide training for CPC, CCS. On top of it, we provide the training for CPMB, Professional Medical Builder, AA Medical Coding. Plus, you are going to get a Coders Guide tool as a practice tool, and also we provide internship also. We are the only institute in India offering the AA Medical Coding and CPMB along with the Coders Guide internship tool. Okay, so don't miss the opportunity.
Sir, I heard, sir, even from the medicine and from the medicine also, there are courses specifically in the same way, along with the training and certifications from the PMBA.
Okay.
Can you please elaborate that?
So PMBA means Professional Medical Billing Association. This organization established in the year 2009 in USA, and recently is acquired by Medicine. We are one of the education partners for the PMBA. And through PMBA, we are offering the courses called CAIMC, CPMB, and fellowship courses. However, these courses are not recognized by APC, not recognized by HIMA. They are the voluntary courses. So to improve your skill, for example, if you take FIMC, HCC, fellowship in medical coding, HCC coding. So in fellowship, what we do, we give practical training. We have training called FIM surgery practical training. So all fellowships are what here? Practical training, practical, not theory part. So already you done CPC, CCS. Now to improve your skills for the cross training, come to the fellowship. So FIMC is the trademark of the PMBA and medicine, and through this PMBA, we are providing the fellowship certification at free of cost as of now. Even AA coding also free of cost, CPM is free, because the trainer, I know very well the value of education. That's why I'm giving that at a free of cost, and maybe for the next 3-4 months you can avail the all PMBA courses without any charge. But I'm sure after January or February you have to pay the money. And we have a wonderful course called CMCC. It is called Certified Medical Coding Consultant. So CMCC has more demand in the market, because CMCC we are going to cover ICD-10, CPD, ICPICS, IP coding, and also SNOMED, LOINC, HL7, FHIR, everything in detail. So I've seen a lot of people, they make mockery about the certifications. Really, sometimes, I feel pity on them. See, until unless you are certified, how can you give training? So a lot of people, they ask me about the CGSA exam. They ask CPM, who's going to train? The exam called CCC, Certified Cardiology Coder. Cardiology coding has more demand in the market. So where do you find trainer for CCC, right? Where do you find trainer for CCC, right? So I am CCC certified. I cleared CCC in the year 2017. Now I'm able to train because I got training. I cleared the exam. I went through AAPC curriculum, and I'm training the people to clear the cardiology certification exam. We have a pool of trainers with the credentials. How they got credentials? Because they have the talent. They have the passion to learn. We are very much focused. We focus on the empowering the candidates, empowering the medical coders with the knowledge and the skill. That's the specialty of medicine.
Sir, one more thing, sir. I just want to ask these questions. because everyone wants to know the reality of the medical coding. There are so many memes. We will talk about that also. Why, for example, there is a graduate completed and you want to come to a medical coding. Why they need to choose a medicine academy? Just give me.
See here, why? Because we established in the year 2004. I said clearly, I got certification in the year 2004. In those days, coding is just budding in India, and a lot of people, I think, even you also, you are just maybe first or second class, right? Okay, in those days, I got certified.
I think I'm in 2004.
Oh, yes, 2004, yeah, okay. So, in 2005, I started training to people. So, I learned through all these years, 21 years. I worked in the US for 7 years. I worked with hospitals in the US. See, I have a practical knowledge. It's not like a trainer taking training from me, again, they're training other people. No, nobody knows exactly how system works in the US. Until you're not in the US, how can you teach US healthcare? So you're imagining something and you're teaching, right? So I'm there in the US. I'm there at the site, on site. I trained doctors in America. I seen how the healthcare system RCM works in the US. Got 45 certifications. Trained 25,000 people. Worked as a coder and auditor for a lot of companies as a consultant. I trained my trainers to teach the way how I teach. I shared my knowledge, and all my trainers are doctors by profession, because medical coding you can teach only by doctors only, right? Not everyone, because see, doctor only, they know very clearly what are the clinical concepts, clinical scenarios, right? So because you can take training from anyone, but when you choose doctor, because doctors, they have a lot of clinical knowledge, they can teach you properly, right? There's no imagination, because we study for 6 years in the college and we learn coding, we teach the coding, right? So this is a medical coding. So trainer should be medical side, medical profession side. Maybe you can say he's a doctor or people from the pharma or BDS or nursing student. And all the trainers are medical doctors in medicine. We give theoretical training, we give live work exposure, live work simulation, a practical training, and also we help them to get the skill by discussions, the mock sessions, mock exams, internship opportunities, all those things. That's why we can say medicine is the best in India. Even as of now also, you can see medicine is famous. But I cannot tell about medicine more.
No, sir.
But success rate is very, very good. And people we set one SOP in the market. People they are following. That's fine. So ultimately, as a trainer, as a responsible citizen of India, I want my students to get the knowledge, to get the skill, to get the job. Ultimately, if they're getting job and they're getting very good career, I'm very happy. And I'm writing a new book called HSC Decoding. This book you're going to publish in next 2 months. I'm the first Indian author to author this book on the HSC coding. So I'm sure definitely this book is going to help a lot of medical coders. And my 3 more books are about to publish shortly next year.
And I observe, sir, that I agree that you're maintaining the quality. Not like other. It's not you're not seeing that as a business. And for the healthcare system, producing the quality coders, that very appreciable.
Even see, that's why even I tell my trainers to study more. All my trainers, if you take Dr. Siddharth, he done CPC, he done CRC, he done CPC. Why? Because until you get trained, you can't train the people. So if I go to Dr. Naresh, he done fellowship in HCC, fellowship in surgery, he done AA coding, he done medical billing, he done CPC. Why? Because you want to get training, you want to absorb the things, you want to give training to the students, right? So that's why you can say medicine is the only platform in India where you get the opportunity to learn all specialties of medical coding. We have trainers like that. Even I'm there. I'm here to help you to clear all specialties. If you see my biodata, I cleared 45 exams, 28 from AAPC, OB-GYN, urology, cardiology, dermatology. Why? Because demand is more in the market. And suppose let's say you got a work to India, some hospital in USA, orthopedic hospital, they want 50 coders. Now they want orthopedic coders. So immediately what I did, I learned orthopedic coding. I went to US, I cleared the exam on orthopedic coding in 2018 and then trained all people in the orthopedic coding. Now they're working orthopedic coders, and because of that 50 members batch of orthopedic coders, work is coming to India. So I can say proudly that I have taken the first step, I have taken initiative to learn and to teach. So that's why I say medicine is always special, especially in terms of the training and the quality.
Even I observe, sir, it's not about the just teaching the what is there and what is the guideline.
Yes.
So more concentrated on the logics behind the guidelines.
Exactly.
That works for the really.
But still, being said all those things, but I really appreciate the people throughout India. Their trainers are there. I really appreciate they're doing very good training. A lot of people, they're taking training from me only. So now my students, they started their own institutes. I'm very happy that they're giving training. But I request everyone to maintain the quality. Maintain the quality. Never go compromise on the quality and compliance. You keep 2 things in mind. Quality and compliance. Okay, and you teach properly, and definitely I'm going to help you. And we are open to give franchisee also. So if you're a student of medicine with the experience minimum 5 years, welcome to medicine. Take our franchisee. We give franchisee with no setup fees. We want to establish throughout the India.
That's good,
That opportunity is there for the certified coders only, not for everyone. And if you're a doctor plus CPC, I'm going to give franchisee without any cost, because I trust that only doctors can teach the coding properly, because these coders work with doctors in US. So that's why it has to come to the doctors only.
That's good, sir. Maybe it is going to initiate the more quality coders.
Yes, quality. Yes, sir. The quality is very important. Yes.
Please tell me, how many different type of jobs after they doing the certification. What the reality related?
See,
to
there
jobs?
are plenty of jobs in the market. For skilled coders, especially if you take Hyderabad is the best place in India. Hyderabad is always best for so many things.
Yes.
And India is always top in the world. India, South India is always, we have more IT companies. In South India, Hyderabad always comes first, right? Because of the government initiatives, right? Because of the overall triple ring road or triple R metro facilities, whatever we have in Hyderabad, work is coming to Hyderabad only. Such a wonderful place. You get more jobs in Hyderabad. And I've seen from past 20 years, every year work is increasing day by day.
Yes.
Second is Pune.
Yes.
So third is Chennai and Coimbatore. And then we have more opportunity in the Aurangabad, also in Kerala, and even in the Salem. So you can see Hyderabad is the number one. I'm sure definitely Hyderabad is going to become the medical coding hub in next 2 to 3 years.
So one more thing, sir. Okay, opportunities are good, and the career how to start. You said that, but I can see that salaries come to there are so many videos also. Is it possible to get lakhs of salaries in a medical coding?
See, first of all, I request everyone, don't do mockery of the medical coding profession. I'm requesting with my folded hands, please don't degrade the profession. You know very well, if a coder taken training properly, if they have the skill, if they go to the right company, they get very good salaries. Even if you can see Naukri also, companies are paying more than salary 1 lakh per month. But why everybody is not getting 1 lakh? Because they're not getting the proper skill. They're not getting the confidence. Because first of all, training itself is not proper. So some people, they go with shortcuts. They go for interviews, they fail in the interviews, they won't get a job, and they're making the mockery. No, please don't degrade the profession. And don't target the people like that. Why? Because we're surviving in the medical field. See, doctors in the USA, they appreciate us. See, 21 years I'm saying, 21 years I'm into this field. People are appreciating the way how we work, and a lot of work is coming to India, and definitely even UK also work is going to come to India shortly, right? So let's respect our profession.
Coming to this, sir, as of now we are following ICD 10. And is there any certification, sir, related to ICD 11?
So very good question, Dr. ICD 11 means International Classification of Diseases, 11th edition. ICD 11 is now global. 194 countries, they're supposed to use ICD 11 only. So last year, CBHA, Central Bureau of Health Intelligence, they called me, and I was there in the training for 3 days. Now I got certificate from the CBHA, from the Government of India, on ICD 11 workshop for 3 days. So already at government sector, we are using the medical coding, ICD 11. Shortly, I'm sure we are going to get a reform. Throughout the India, all hospitals must use ICD 11 code compulsory.
Oh, that's good, sir.
Yes, and even if I've seen one recent news also, the private insurance companies, they're facing a lot of problems in underwriting. A lot of scam is going on. A lot of money is getting wasted because abuse and fraud happens more because when there's no reform, there's no compliance.
Yes.
So medical coding is the only way to save the India healthcare industry, especially the India health insurance. So I'm requesting India Health Insurance to implement ICD 11 in the health care claim processing. So what I suggest is, we are here to give training on the ICD 11 on the SNOMED and the LOINC. We train your team on the ICD 11. You do the coding of your claims, do the historical data claiming, the historical data medical coding on ICD 11. Then when you do underwriting, use the ICD 11 coding system. So this way what happens here, you can prevent the abuse, fraud, you can get the proper statistics, and you can control the cost, and also you can improve efficiency in the claim processing. And trust me, medical coding is the only way to optimize the India health insurance. So I'm very sure India Health Insurance, private insurance, they're going to start ICD 11 very shortly, and all medical coders, they'll be very happy when they get the ICD 11 implemented in India. It's going to happen very shortly, according to 3 to 4 years. And then all coders, now you become senior coders and you get a very good job.
Even sir, even recent years, sir, we've seen so many issues for the providers.
Exactly.
A lot of patients also.
And at medicine, we give training on ICD 11. Again, if you ask me how we can give, because I went to CBHA, Central Bureau of Health Intelligence, in New Delhi. They called me for the ICD 11 implementation program. I was there for the workshop for 3 days. Now I got a training. And if somebody does mockery, why you done ICT 11 means, for them there's no answer, right? Because I pity on those people. That's for the ignorance and innocence. See, తెలుగులో చెప్పాలంటే చదువు అంటే సరస్వతి. ఎప్పుడైతే చదువును అవమానిస్తారో, you're nowhere. Respect that profession. Respect the people who are doing the very good job. Right? That's what I request everyone. I request all medical coders, take training properly, follow the medical coding guidelines, ethics, compliance. Keep in the mind there are no shortcuts for the exam. Don't fall in trap of the shortcuts. Practice at least 1,000 medical records. Then only go for the exam, then only go for the interview. And I request everyone, not only coding, take training in the medical billing and also AI also. Without billing and AI, if you learn the coding, is of no use. Because I'm this profession since 21 years. I'm telling you with my experience, expertise. I've seen a lot of people, they're suffering because again, you can't come back for the billing training and AI training. So in these 4 months, take training for the coding, billing plus AI. So at medicine, we provide both. Training for CPC, CPMB and also for the AI medical coding. Right? Thank you.